media partners that are joining us here from across the state. We're very pleased today to have two county executives, two regional leaders, the Broome County Executive, Jason Garnar, and the Oneida County Executive, Anthony Picente. These press conferences were designed early on to help share information from the regional leaders to other counties around the state that could benefit or learn from each other, and have been very successful in communicating information. And I just want to do a quick rewind here of where we were at in March and April, and that is that we were in the early stages of a pandemic response. The county executives across the state of New York, the two county executives that are with us here today, had to declare early on states of emergencies. They had to begin the process of tracking expenditures, designating emergency, essential employees and non-essential employees, developing emergency communication plans, securing those precious personal protective equipment, the PPE that has been discussed so much in the news across the nation, across the state, monitoring the issuance of executive orders, preparing a plan for lost revenues. Those buckets alone are very complicated, very time-consuming. That was an internal focus. But as we went through March and April, the county executives had to shift into a community-based focus, focusing on enforcing restrictions on things such as mass gatherings, or restaurants, or taverns, gyms and bars, identifying areas of mass quarantine facilities, where to put folks who couldn't isolate in their own residence without having the proper precautions, things such as hotels, popping up mobile test sites, or establishing places for folks to get diagnostic testing, enforcing anti-price gouging laws, communicating daily with the public, and beginning, the process of scaled up contact tracing. So that was March and April. As we go in through May and June, we are positioning into a recovery phase here. Before the state began preparing for the reopening, counties were already engaging local businesses, doing surveys of their businesses about the economic impact, creating resource pages, encouraging folks to buy local. The governor then declared, of course, the 7 criteria for the 7 metrics, if you will, for a reopening phase: the decline in hospitalizations, the decline in deaths, new hospitalizations, hospital capacity, ICU bed capacity, diagnostic testing capacity, and contact tracing capacity. And then, of course, in the month of May, we had regional control rooms that were established in the various regions of the state. This is a lot to do, county executives, as part of your regular job of serving the public, protecting public safety, offering health and human services programs, maintaining infrastructure, which is a very critical time at this time of year to establish, implement infrastructure projects, parks and recreation. I really commend both of you for juggling all these multiple tasks as public servants and doing it so in a manner that is effective and communicates and relates to the public. Let me go to Jason Garnar, the Broome County Executive, and ask a question of Jason about reopening in phase 1. You are located in the southern tier. Can you tell us about the population of Broome County, the population of the region in the southern tier, and what's it like to be able to re-emerge here under phase 1?
So our population in Broome County is about 200,000 people. The southern tier region, we always have to think as a region now because we're being judged as a region. Our population as a region is about 630,000 people. We share some interesting, we share a border, a very long border with Pennsylvania. So we've had to keep an eye out on what's going on in our counties south of us there. We're also in the pretty much in the middle of the state. We're between, we're 3 or 4 hours away from Buffalo, 3 hours away from New York City, an hour or so away from Syracuse. So we were really glad to be one of the first regions to be able to reopen. As soon as we saw that the metrics were put out, we had to really work with our fellow county executives. And I know Anthony's done that with his fellow county executives up in his region, but we've had to work together to make sure that by May 15th, we met all those metrics. And that required a ton of coordination that we haven't necessarily done before, maybe on a somewhat of a regional economic development council, but we've never done this level of coordination. And, things like making sure that we were testing enough to get into the testing category to meet the threshold for that. Also with contact tracing, for example, we had 3 contact tracers that worked as contract tracers on infectious diseases before this pandemic started. We're now up to 50. We didn't hire those people. We just shifted 47 people into those positions to make 50. We've also trained an additional 50 that if we have to go to other parts of the region, some of the other counties are very small. They don't have huge health departments. So we've made a reserve of contact tracers that if needed, they can go out to other areas. We've been open since Friday. Things seem to be going well. Our numbers really haven't changed. Of course, every day we look at those metrics and see if they're going up. But it looks like we're on the right track. And knock on wood, if this whole thing is going to be reevaluated every 2 weeks, and as long as our metrics are under the threshold, we expect to be opening up our second phase Friday of next week.
Thank you very much, the Oneida County Executive, Anthony Picente. Anthony, let's talk a little bit about reopening in Oneida County, also in the center of New York State. Basically, tell us about the population of Oneida County and the population of the region in the Mohawk Valley. And in particular, can you talk to us about the types of industries that are open, the construction businesses, both residential and commercial construction, retail establishments, curbside retail? What does that mean? How do businesses know what to do? Is there any process that you can share with us of how information is flowing back and forth? Hold on, Anthony. We got a problem on your audio there. There he goes. Go ahead, Anthony.
Oh, there we go. Okay. All right. Thanks a lot, Steve. And thank you for having me today as well. And great to join my good friend and colleague, Jason Garnar, who's doing a great job in Broome County. And thanks to everybody else on the line. We opened as well as along with Jason in the Southern Tier on the 15th. And it's almost like Jason could probably relate to this, a little bit of a sigh of relief, collective throughout the community when that happens. But our population in Oneida County, we're about 235,000 people. The entire Mohawk Valley region is a little over 400,000, about 420 to 440,000. The remaining counties are much smaller, rural counties from Herkimer, Fulton, Montgomery, Schoharie, and Otsego counties. And we work very closely, as I know Jason does, with the Southern Tier, and we collectively have worked on various other areas of economic development. So working together in this crisis was nothing new for us as we collaborate on different things. But we've been dealing with the reopening. Again, it's almost like, I guess you would kind of characterize a little bit soft in regards to a lot of construction was taking place. This was more of the independent contractors and the home construction and renovations and some of those businesses. The agricultural community, which is so big in Oneida County, really needed to move forward in some of those areas of planting and landscaping, and that's a big part of it. The retail, the curbside is something new, and with the exception of the big box stores that have been allowed to be open because of the supply chain that they're a part of throughout the state and the country. So you have a lot of other stores that have been shuttered, and small businesses in local shopping centers that are long-standing businesses here in Oneida County, like they are throughout New York State and America. And so this is a welcome opening for them, even if it's curbside, which is a little difficult because you have to call and order, or if they have a website and go through that. But the governor also said you can go inside and pick out item, but not shop for it. So those are going to be the challenges that businesses are going to have to deal with, and hopefully, as we get into phase 2, that gets lifted over the next in the next week, as Jason said. That'll alleviate some of that. The issues that we're dealing with are in terms of the control room, or in terms of the data that Jason referred to, the tracing that's going on all of these contacts. We have right now 75 in Oneida County. And again, we're the biggest county in this region. So a lot of the burden is fallen on us because we have the largest numbers, and our population is equal to the remainder of our region. So we're tracking a lot of those cases, and have been right along, and helping balance out that criteria that's necessary in the governor's baseline for what we have to meet. Our hospitalization rates have stayed low. We're pleased with that, and while our numbers are going up because we're testing more, the percentage between the number tested and the positives is going down, which is a good sign, which means less people are infected percentage-wise, and that's good information to find out. But we have a ways to go, and we're hopeful that as we continue, our numbers stay in that range that we can manage, and everybody looks to the next phase as soon as you start the first one. So that's the other challenge, and it has been a little difficult trying to keep everybody at bay because there's so many other businesses out there that want to reopen, want to know when, so they can start preparing. We've worked from day one, as you said, Steve, and I know Jason, we were among the first to declare states of emergencies, close schools, close senior centers, do the things that we needed to do to get a handle on this virus in our communities. And there's clearly more to do, and we'll keep doing it. But everybody's it's the impatience, and a lot of that has come about because of the change in weather. I mean, the weather was on our side because it kind of kept people home during this time. We didn't have a great spring up here, and weather-wise, and so it kind of kept everybody in lockdown a little bit, which helped us and clearly helped the spread, stop the spread in the numbers. But it was coincidence that on the 15th when we reopened, and I'm sure Jason would say this, that all of a sudden it became 70 degrees, and so that's the hard part of keeping everybody down when they all want to get back together, and we all do.
Thank you, Anthony. A very anxious population here. We've been under wraps for 60, 70 days now, and staying in our houses. Jason Garnar, I think as county executives and regional leaders, county governments, we've learned an awful lot about the healthcare system. As we've gone into this here, we've now learned the terms intensive care units, ventilators, intubations, things we often wouldn't have thought about as county officials. Can we talk a little bit about the hospital in Broome County, the hospitalization capacity in the southern tier? Probably something you hadn't thought an awful lot about before this pandemic, but it's certainly something on your mind today, the hospital capacity in Broome County and in the region. Can you tell us what's on how you are interacting with hospitals right now, and what's on your mind with the hospital capacity issues?
Sure. So, previous to the pandemic, we had some communications with our hospitals, mostly economic development related. We have two large hospitals in Broome County, and they're probably one of our top 5, and both of them are our top 5 employers here in Broome County. Ever since this started, we've been basically talking to the 2 hospital CEOs every single day about just what you were talking about. We talk, they check in every day with us, with my team, with our Office of Emergency Services, my executive team, our health department. They talk about the types of patients that they're seeing, the numbers that they're seeing overnight, anybody that's on vents. Early on in this, we didn't know what the heck we were getting into. We didn't know if we were going to become more like downstate, more like New York City, or if we were going to follow different paths. So early on, for weeks, we wanted to know how many ventilators were available. We wanted to know how much PPE they had. We wanted to know how much testing they had. Very early on in the pandemic, we had very few tests. I mean, very, very few tests. Basically, we had so few tests that we were kind of banking those tests that the hospitals were to that if their staff saw a huge infection problem in their hospital, they could go and test all their own people. So the tests were kind of kept in reserve, but we were able to procure a lot more tests. We've done, I think, over 7,000 or 8,000 tests now, and it's really picked up over the last 3 or 4 weeks. But no, we never knew anything about intubations. We never knew any, I knew about ICUs, but never that much in detail. And I guess to really spell out what's happened here over the past couple of months, we really never become close to being overwhelmed. That was the whole concern, was that as this thing started, we thought, gosh, are we going to get overwhelmed with this where our hospitals simply can't take care of people? We actually converted our arena into a 50-bed hospital facility because we thought there might be overflow. And that never happened. Our infection rate, I think it's similar to the region that Anthony's in, but our infection rate was not like New York City's 20% infection rate. It was 2%. So thankfully our hospital systems did not get inundated, but what they're dealing with right now is, as we start to begin the recovery process, they've had very, without elective surgeries, which is a good portion of their income, they've had a heck of a time, with the lack of revenues. They're struggling mightily. We're really glad that they were allowed to resume elective surgery, but they're going to have to begin that slow process of recovering themselves, because for 2 months they took a huge hit to their revenues. And we're also now looking at people who, there were a lot of people that didn't want to come to the hospitals because they were worried that they could be infected if they came to the hospitals. And now that worry is gone, they're seeing people who have come in that have put off care for months. And, that has a detrimental effect as well. So they're trying to make up all the elective surgeries. There's a huge backlog of elective surgeries. They're also starting to identify people who have problems because they didn't get any, health care for a couple months and put that off. So we continue to talk to them, every day. And it's about different things. Like today we were talking about we have a large university, Binghamton University, that has made plans to have their students come back in the fall. And now we're talking about putting out modeling for that. We have probably half those students come from downstate. So that's something we're keeping an eye on. How are the students going to come back? How they're going to get tested? What impact we're going to have on the hospital? So it's a good point. I mean, we've never had this level of dialogue with any of our hospital systems before. We do now, and we're probably going to have for some time.
Thank you. A lot of lessons learned in the healthcare system: urgent care, primary care, hospitalizations, contact tracing, diagnostic tests, antibody tests. We've all learned a lot of things through this pandemic about the healthcare system. Thank you, Jason. Anthony, economic development, small businesses, Oneida County, all the counties, all the regions of the state have lots of small businesses, mom and pops. Your area in particular is known for its ethnic foods, its rich tradition of culture, of generations and generations of family recipes that are serving people. These recipes can't be replicated in large types of chains. Are you concerned about reemerging from this in small businesses, and what effect that might have for folks in your county, in your region, and for all other parts of the state?
Sure, Steve. And let me just go back to the previous question to Jason. I want to just say that Jason could answer for us in the same vein. I mean, that all that he talked about with the hospital relationship obviously is centered more around economic development, jobs, and growth, and the like, but really changed. And all this changes in a state of emergency anyway, and that was the first group we met with immediately upon the state of emergency here and going forward. So, but that's, we could talk about that. That's the story of county government, as you know. We're on the front line of that, and that's what our public health department does. The business aspect that we've been talking about, and clearly on the small business end of things, when you look at small businesses and whether they're small shops, which we've seen a resurgence of in our downtowns over the last few years. Downtowns that used to be more deserted because of the malls of the 70s, 80s, and 90s, and the big boxes that take place. We've seen a resurgence of downtown growth. Then all of a sudden things get shut down. So you've got a lot of those shops, but a lot of those restaurants that you mentioned that really were a resurgence because more people living in our downtowns than our urban areas now than they were before, and so many different types of ethnic foods and specialty shops that have opened up. But then some that had just opened up literally at the first of the year and then had to be shut down in the middle of March. I'm very concerned about those businesses because they were part of a resurgence that we all started seeing in terms of our overall economies, the things that we were doing in total with the business community, growing from the ground up, and especially with the diversity here in Oneida County and throughout the region. I'm concerned about that. I'm concerned about those businesses' survival or whether they can reopen. Many of the restaurants and other establishments that are longstanding, but have the capacity and have the wherewithal and are dinner based and for evening takeout. The daytime places are struggling because not as many people are working right now and physically in downtown areas and in urban settings where people are walking out for lunch, especially now as the weather gets better. People are able to go outside more. Those restaurants are now closed because they're only for takeout. It changes the dynamics of what a small establishment can do as opposed to a larger business. So I'm very concerned about that, and that's why it's important as we reopen and to get to our next phases and try and work as best we can with those businesses to establish and maybe change some of the we talked this morning about changing some of our zoning and our laws about outdoor eating so that they have a greater capacity of what they're able to do where they couldn't do it before, and we may be able to see that more in the days and weeks ahead, because they're going to need that to reopen because they're not going to have the capacity indoors. So maybe we can split it up a little bit and do a little more unique New York City experience that maybe we can have, where some people eating outside, in the good weather that, we only have 4 or 5 months of up here, hopefully. But again, to boost that business activity that is so desperately needed and has been shut down. 8 weeks is a long time for a business to be shuttered, especially a small business.
Thank you, Anthony. Jason Garnar, we have gone through quite a bit of an economic shakeup in our economy here. I ask both county executives now. Jason, I'll start with you about the revenue impact, the revenue loss that you're seeing. Of course, government operates through taxation. We collect the taxes from the people and we spend the taxes on the people and for the people. We're seeing declines of very serious declines in sales tax revenues that are used to fund public safety, fix roads and bridges, serve the public and 911 dispatch. How do you think you're going to manage through this crisis economically? At the same time, the state of New York is looking at a $13 billion deficit and is likely or expected to cut programs. And that really means reimbursement to Broome County. How will that impact you? And then why is it important for the United States government? What role do they have to help Broome County through this crisis? And do you expect that financial aid to come?
Well, just to preface it by saying, up to this point, up until 3 months ago, over the past 2 or 3 years, our economy has really grown. Our unemployment rate's going down. Anthony was talking about some of the smaller cities coming back from being devastated by the growth of malls. over the past 23 years, we were seeing a small city resurgence. We were able to build up our fund balance here in Broome County from $250,000 to $15 million, which is a 60 times increase just in 3 years. Things were going really well. This thing hit, and when you shut down businesses the way the businesses were shut down across the state, you're going to see a tremendous lack of revenues. So we're feeling it the worst with the sales tax revenue. I mean, we look at every week we get the new sales tax revenue, and you can just see the minute things were shut down, they took a nosedive. We're down about 23-25% in sales tax. We're estimating just in sales tax alone an $18 million sales tax hit. And to give you an understanding of what that looks like, for every 1% tax increase is $750,000. So that's a lot of that. There'll be a lot of taxes to make up. But it's not just there. The DMV is really not open. We're seeing less money there. Every time a house is sold, which not many are now, we get a mortgage tax through that. We have 2 casinos in our region where we were getting about $4 million a year. Those 2 casinos, Del Lago and Tioga Downs, have been shut down, getting no revenues there. I mean, we're estimating that if the state comes and does cut us even 20%, our kind of best case scenario is a $30 million budget shortfall. And so we've taken some proactive measures, but we've done a furlough. We've done a voluntary furlough of employees. 56 employees took that. Hiring freeze, no discretionary, no spending except for the most minimum type of spending, basic spending, no travel. Canceled $7 or $8 million of capital projects this year. We're talking about that doesn't even begin to make up $30 million. This is an unprecedented pandemic that's hit us. We treat it as it's like a natural disaster hitting us, and we expect that, just like any other state, that when states come into these hard times, when they see these disasters hit, we all, the other states come together at the federal level to help out these very affected states, and we need this help. And I look at the 3 stimulus packages that have been done, and I think in a short amount of time, they tried to get the money to where they needed it to get to. But one thing that they haven't done is help the governments that are fighting this crisis more than any other government, in my opinion, and that's the counties. The counties are the ones that have the health departments. The counties are the ones, we've operationalized this all out of our emergency services department. I mean, we're treating this pandemic like a flood or a massive snowstorm, but we're fighting this, and we haven't been received. We haven't received any help yet. So my hope is that the federal government will do this 4th round, and they will target helping the local governments that have been in the trenches fighting this ever since this started, and that's the counties.
All right, Anthony, let's go to you to the last question. Thank you, County Executive Garnar. Anthony, last question, and then we'll go to our media partners and see if they have some questions. Let's talk about enforcement. These has been some trying times these past few months. The interpretations of executive orders are very difficult, complex, changing every day, sometimes multiple times a day, of interpretations of executive orders. The governor, of course, establishing the ground rules, and then having the local governments enforce those ground rules, taking some calls and reports about faith-based institutions wanting to return back and congregate. A lot of challenges to, well, you can't force me to stay in my house. I should have the right, the freedom of the assembly. A lot of constitutional issues at play here. Any thoughts on enforcement as we continue to go through these summer months? How difficult will that be for local governments?
Well, it's going to be continue to be difficult, and it's been difficult from the very beginning as this pandemic struck, and as we started restricting. And when you first, I always say, shutting it down was a lot easier because when you close schools, close senior centers, you start restricting and close the playgrounds and the other recreational activities, and then other social activities that take place with different, whether it's museums and libraries and the zoo and all of those things that are a part of the community. That's the first part, and sometimes that's a lot easier. And then it's as the impatience that we talked about starts growing, but then as the governor comes out with different aspects of this and different times. And as you say, we find out about it the way the public does, which is sometimes very unfortunate because we're called upon to, as I say, often call an audible within a very short period of time, and then have to deal with enforcement and looking at it from our perspective of always, as we all have tried to do, is stop the spread, flatten that curve that everybody talks about. So as all of these things are moving parts, enforcement does fall on local governments, but that local government, as Jason really eloquently said, are the counties. We are the front line of this. Let make no mistake about that. And we have been given those challenges like no other level of government. And that is, as I said, the story of county government. So I share what he said about the federal government providing us the assistance, because our work didn't stop throughout this crisis, even with reducing our workforce at times. But so the point of enforcement, we had to institute a mask order, again, on our end for all businesses. And, that came with a lot of angst and a lot of grief, and understandable. But at the end of the day, it was necessary for us to put forth that. Now, as we go forward, some of the other things that have been allowed, the announcement by the governor just days ago about beaches really throws a wrench into local governments, and especially then when we break it down from the county level of what our responsibility is, and to the locals' responsibility in place of towns and villages. Nobody has the capacity to meet the requirements that the governor has set forth, which I understand them. They have to be strict. They have to be controlled. Yet, then it turns out that we become the bad guys in this because we can't meet those requirements under the restrictions that have set forth. And therefore, it becomes hard to control when people just, and I understand that. People are, they don't want to be told that they can't go somewhere. They can't go to someone else's house for a barbecue, that they can't enjoy, and go to a park and do what they normally do. Or they can't even go to a beach on Memorial Day because we can't meet what those requirements are. So it becomes very hard, and it's going to be even harder as the weather turns, because we all know that in New York State and in our regions, and Jason shares that, we share this, the summer season is short, and people want to be out there doing things that we do each and every year and enjoy in terms of our parks and our lakes and and all that we have to offer. And that's going to be harder as we go forward, but that's why our people have been patient. They have been disciplined. I always say there's a 90% compliance rate. It's that 10% that we have to deal with. That does make it hard because we don't want to cite businesses. We don't want to cite individuals. We want to be able to do this in a fair and equitable way going forward.
Thank you to both county executives. Very much appreciate your time. We'll take some questions from the media here now. I did want to say that of the Western New York, the Finger Lakes, the Southern Tier regions of the state, the Mohawk Valley, Central New York, Capital District area, and the North Country, that's about 4 million in population, round numbers. Outstanding is the Mid-Hudson region, of course, Long Island, and then New York City, with about 15 million people in that region of the state remaining closed. The microeconomy of that region of the state is still underway, but the macroeconomy in these phases still we're not able to enter phase one in that part of the state. So a lot of lessons learned from both of you county executives and the great work that you're doing to help the downstate region. So thank you very, very much. Mark Levine, let's see if there's some questions from our media partners.
We do have questions. First question comes from Andrew Donovan, and I will remind all of the participants on the phone or on the call here to please raise your hand, and I will try to get to all of you in order. Andrew, you're unmuted.
Hi, everyone. I'm Andrew from News Channel 9 in Syracuse, and Tony Picente knows this, but I'm a lifelong Oneida County resident, proudly, so I'll just get that out of the way first. I've got my Utica mug here on my temporary home studio that I'm calling from. Anthony, my first question, and just a couple about the Turning Stone and the Oneida Nation casinos. Sure. Was your office or your health department alerted to the fact they were opening outside of the state's suggested phases? And did your health department get to approve of the plan or help write the plan?
Sure. Well, that's Turning Stone is such a big part. I know Jason referenced the casinos in his area as far as revenues and jobs and all of that. So Turning Stone is really an economic engine that is so important to us in Oneida County and in central New York. We've had a great partnership with them, as you know, over the years and continue to do so. And yes, we were absolutely consulted and talked to them throughout and actually were allowed input. And it wasn't just a review. It was literally, we went through almost line by line the plan and worked with them on it and actually put in some requirements that we wanted to see as a result of that. Recognizing that the Oneidas are a sovereign nation, they had been participating and have complied, and they were the first casino to close in New York State on their own, which again, that's not required under their status, but they've been great corporate citizens and great state citizens. And when you look at it though, Andrew, they're looking at the June 10th date, which really centers around what would be, and it's our hope and our belief that phase 3 would approach at that time and that they could meet that time period. So it's not that they're jumping in right now and opening today or tomorrow or even had opened on the first phase. They're looking at that time period. And we believe that the plan is, and I've looked at other plans around the country actually of casinos, and there's nothing that comes close to what they put forth. And again, it has limitations. It doesn't do shows. It limits the restaurant capability like other areas. So there requires masks and gloves for all their employees and temperature taking and restricts the travelers to a 120-mile radius. So a lot of what we insisted upon and requested, or all of what we worked on was put into that plan. So we were a part of it, and clearly it's pretty intense, and I credit them. They've done a great job in putting that together, and it's in everybody's interest that they reopen. This goes back to getting our businesses, and there's about 5,000 people there that need to get back to work.
Just to follow up on that, what was one specific thing you wanted to see and asked to see in that plan? And yes, they are they're so big and offer so much that you could argue they were part phase 3, but part phase 4 in the recreational side of things. Might any other businesses be upset that they can't open with the same kind of gusto at once kind of thing, especially those recreational type facilities that I think are phase 4?
Well, the recreational, we talked about that, and whether you look at the casino side and the restaurant side of phase 3, but one of the things we said was no shows until no massive type gatherings of shows, and whether it's in the showroom or the event centers or any of the venues at exit 33 or any of those pieces. So all of those things are not included in that opening. And so when you look at what they're doing in terms of what they and what they always do and can do, that's been limited. The other thing, so it was about that. It was also about the 120-mile radius that I talked about, because we wanted to make sure that we were not opening it too wide a swath to allow people to come from other parts of the state or the north and the north, south, east, and west that would be perceived as getting outside of the zones of what was open and where the hot spots were, and trying to limit it to that population within. So I think all those things and some others that we looked at, but those were the two big ones.
Thank you, Anthony. Be well.
Thanks, you too, Andrew. Good to see you.
The next question comes from Jeff Platsky of the Binghamton Press and Sun. Jeff, you are unmuted.
Thank you. Good morning, county executives. I've got a question and a follow-up, but first question is, county executives, do you want Governor Cuomo in the legislature to give you a reprieve on the tax cap?
Jason, you want to?
Do I want them to give us a reprieve on the tax cap? My understanding is that it can be overridden with I think a 2/3 vote or something like that by the legislature. I think what I'd rather have is a reprieve from mandates. That's going to be the easiest way for me to reduce the burden of property taxes here in Broome County. So I think the session still has some time left in it. If they wanted to be more helpful to counties, I think that working on the unfunded mandates, or maybe just not when they come to do their cuts to local government, they think about counties and they think about what counties are doing right now, especially during this pandemic, and they go easy on us.
Yeah, I would, I'll echo that and share it. I don't think any of us are looking at the particular time in this economy and what's happening. I mean, we've got some months before we put our budget together, but this is not any time we want to talk about raising people's taxes when I've got nearly 15,000 people out of work in Oneida County alone that are on on unemployment during this period. I share that agreement with Jason that what I don't want is for them to cut the local aid that we've been that we are entitled to, and in terms of running these state programs that we run on a regular basis. I want them to share the FMAP money that came from the federal government that we need right now because of our expenses. The state has put specific burdens on us to require us to provide PPE and the like to other municipalities and the hospitals and first responders and all of that that's under, and so they can't turn around and take it back, in lieu of this, and also supporting, as Jason says, we're the front line of this for the state, and that goes back to the federal message, but it also goes to the state message. So the tax cap is not something, if we need to override it, we could do. We've always had that ability to do so internally for those needs. That's not what we need now. We need relief. We need federal money, but we also need the state not to take any of what has been promised and what we're entitled to and what we've been working on. I mean, these are programs that are essential during this time as much as any other time.
As a follow-up, Jason, you talked about hospitals, but one of the issues Broome County, and I'm sure Oneida County has faced, is childcare issues. You've already had an issue of a dearth of childcare. When we exit this, some of the childcare that was existing before may not be existing afterward. Do you have a solution? Do you have, some of these parents are going to be desperate when things open up for childcare again, and there may be a dearth of openings again?
Correct. So again, one of the things that the county has, we've been involved in daycare issues before and childcare issues before, but never to this extent. We actually had to set up an emergency daycare for essential employees. We closed our senior centers and repurpose one of them to be a drop-in daycare and have people from our library, workers from our library that's been shut down, workers from our office for aging that used to work in the senior centers, watching those kids along with school resource officers. But anytime we might have 25 children in that facility. With that being said, we're facing a kind of a critical time here that we've never seen before. We're looking at already in one of our largest municipalities, the town of Union, is canceling its summer programs for kids. We have a lot of summer programs that they're very unsure whether they're going to be able to operate or not. At the same time, we have schools shut down still for the next month or so, which is a place for parents to, that they don't have that now. So they have to watch their kids. And so while there's a lot of uncertainty about summer programs, some daycares have already shut down. The question is what can the county do, understanding that a lot of people are going back to work. It's kind of coming at the worst time. A lot of people are coming back to work over the next 4 weeks. We might not have the summer programs where a lot of their kids were watched. So I'll tell you, my 3 kids go to a summer fun program out of our school district. We're not sure what we're going to do. Obviously I work, my wife works. We're not sure what we're going to do with that. So right now we're working with our municipalities, we're working with daycare providers, and we might have to increase the size of that county daycare if there's no other options, because we do have to get our workforce back to work, and they need childcare. And if there's no other private sector or other types of programs that are typically available during this time period, we might have to step in and do some things we've never done before.
The next question goes to John Campbell from USA Today in New York. John?
Hi, thanks, Mark. County executives, you're both on these regional control rooms that are supposed to monitor the metrics. What kind of work are these regional control rooms doing? What goes on in these daily meetings that you have? And do you have any actual decision-making authority?
Well, I think, first of all, the local decision-making on a great many of these issues have always fallen in the county's laps. And so we do have decision-making in terms of certain restrictions as we see fit. For example, in different areas of recreation and what we've closed and what we've decided to keep restricted in terms of parks and recreation campsites, different things like that we have those discretion on, and the enforcement aspect of it that we talked about a little while ago as well. The control rooms are, as understanding, as I understood it from the beginning, are really supposed to look at the data and look at and make sure that we're meeting those 7 criteria that have been established in order for us to, first of all, open in the first place on the 15th, which we did, and maintain those numbers going forward. And we've worked, my county government has actually been managing the data for the entire region in terms of the hospitalization rates, the ICU rates, all of the things that go along, the tracers. We've been keeping the dashboard for the county, for our region, for the Mohawk Valley region, in doing so. The other piece on the calls is it's really about a lot of questions that we're sending up the chain to the state to get answers on that we don't have clarity on a regular basis, because as I said at the beginning, a lot of what we hear from the governor is the same way everybody else hears it during his daily briefings, and then it's really getting clarification afterwards. Just what did that mean, and what are our parameters in doing? What has been put forth regarding those executive orders. So it's really a combination of both, but the real main focus has to be on the data that is so important, and the testing that needs to get done to meet that data.
I apologize. I didn't mean to suggest that county governments don't have any authority. What I meant to ask was, so say the metrics go in the wrong direction after you're already open. Is it the regional control room's call to, perhaps slow down the reopening process, or is it the state's call?
I believe it's the data drives that. So I think once it's the role of the control room when they see the data starting to move, to try and figure out where that's going, and whether or not we have a hotspot or something that's triggering that in a particular area, especially on the hospitalization side, which is that's where the healthcare rates are really the big ones that everybody's focused on. And then again, of course, it's the tracers and what we have to do in order to meet those requirements. So I think it's really a combination of looking at, if those numbers start going askew, where do we see it coming from, and is there something that happens? But I think ultimately at the end of it, if as Jason can say, or we talked about, if those numbers don't match up by next Friday, then we don't move into the next phase. We stay in the holding pattern and go forward from there. Jason, I think you would agree on that's the way I understand it. So
yeah, that's the way we look at it. I mean, a lot of the control room meetings are, we're information gathering. We're getting inundated, as I'm sure Anthony's office is, with phone calls from businesses. What phase am I going to be in? I'm open, but what can I do? How do I do this, or can I do that? Can I try to be in this phase if I do that? I mean, it's an opportunity for us to pitch all those questions to the state. It's also a little bit like, I guess I look at it if this is a war, we're kind of like the cavalry. we're kind of we have the boots on the ground. We know what's happening. Anthony talked about hotspots. You know, is an infection spreading here or there? What's going on? How are you dealing with this issue in your community? Kind of those types of things, which I do hope, you know, the state is hearing all that, and that is factoring the information they get from us, the county executives of the control room meetings, is stuff that will then go to Albany, and that information, that data, and that those conversations will be taken into account as decisions are being made at the state level.
The next question is from Harrison Grubb of Spectrum News. Harrison, you are unmuted.
Thank you so much for having this today. My first question, now that these regions have been open for about a week, what are the biggest challenges as we continue to move forward, hopefully keeping those metrics so that the reopening process can continue?
Well, Harrison, I guess the biggest challenge right now is, the collective impatience that goes on. As Jason said, we get calls inundated each day, or we get inundated with calls each day about when can I open, how can I open, how do I do this? And everybody's looking for that next phase and looking to see where they fall in the scheme of things, what they need to get going forward, or to get done now. And so it's a lot of the impatience. That's the challenge, I think, going forward. And as I said earlier, the weather presents the challenge just with the, aside from the whole business community and the aspect of getting people back to work and businesses reopen, is the individual activity, that, the family activity. Those are probably the bigger challenges that we hear of all the time, when it's hard to stand up every day. And I know that Jason does the same thing in Broome each day, talking to his constituents, as I do here, about, try to stay home, not move around. And that impatience is wearing very thin. And we're not trying to control people's lives, we're just trying to save them. And that's what I keep saying each and every day. So it's really about, at least I would say, and I'll pass it over to Jason, but it's really about that impatience that we're dealing with. That, once you start this opening or reopening, how it's been termed, there's the movement of, okay, how much more can we get back to normal, and which is all good, but it presents challenges in terms of enforcement, and presents challenges in terms of answering the questions and getting the proper information to them.
And just to touch on what Anthony said, if COVID is a war, I believe we're fighting it on three fronts. The first front is the public health, which has not gone away. We're still, unfortunately, seeing people die in Broome County and throughout the state. That's still happening. So we're still fighting that front. And then there's the reopening, and we're just into the first phase of that. So, like last week, I had 3 Zoom calls with businesses, and we just said, look, we have a lot of information from the state. We sign up, we'll get it to you. And also we want to hear what you have to say so we can advocate for you. We had 550 businesses participate in those 3 meetings last week, and we're going to have more. And then really the third part of it is, the last front is the budget front, which, county executives, across the whole state, it's not just Broome County or Oneida. You're looking at unprecedented budget revenue gaps, and being asked to spend a lot more on this pandemic than any other type of municipality leading this, but with millions, and not just millions, tens of millions of dollars of revenue that's gone. How do you fight something you've never fought before and have to spend more money when you have a record loss of money? So really, those are the 3 things that I think will happen, indefinitely, that we'll be fighting.
Yeah, and just a quick follow-up on the financial aspect of that. On the county level, also the regional level, with this budget gap, does that kind of complicate it all? Because unfortunately, this crisis probably isn't going anywhere anytime soon. How does that complicate the ongoing response?
Well, first of all, you got to, as we've been saying, we're buying millions of dollars worth of PPE. The overtime that we have for our workers on the weekends and nights, and doing the tracing, but also doing other aspects of this, and dealing with the normal course of business in county government, which doesn't stop. I always, Jason talks about the revenue side of things, and one of the things that's important that I've said in all my time in office, that for county governments, when the economy gets bad, when business gets bad, our business picks up, and that's the case here. And so we have more people that are in need in bad times. We have other issues that we have to deal with, all the other social issues of whether it's mental health, whether it's domestic violence, whether it's child abuse and neglect that we have to deal with, that changes the dynamics because schools are closed and all of these things come in. That's the normal course of business for the county. So we're answering the call of the pandemic, as Jason so perfectly put, as the cavalry, as the boots on the ground. We're the boots on the ground all the time, and we have all of these other functions that still have to be taken care of, dealing with homelessness, dealing with people in emergency situations. I mentioned 15,000 people that are unemployment. They're going to end up here in some fashion, or many of them in different ways. So all of that is compounded as we go forward throughout this and required as part of what we do in our normal course of business. And now it gets multiplied because we're the responder, we're the first responder on the front lines of this with our health departments and with public safety and our emergency management system.
With no more questions, apparently, I will turn this back over to Stephen Aquario to wrap up this morning's event.
Again, I'd like to thank the county executives from upstate regions of the state of New York for sharing their perspective. Thank them for all that they're doing. Again, about 4 million people right now, businesses that are located in these 7 areas or regions of the state are operating under a phase 1 reopening. Memorial Day coming up. It's May 20th right now, Memorial Day coming up. And on non-essential gatherings being softened a little bit here to allow Memorial Day gatherings up to 10 people. County executives will have to be concerned about that and how that will affect their community and parades and things of that nature. But I really look forward to the time when we can have the 15 million, the rest of the state open, the Mid-Hudson region, the Long Island areas, and of course the city of New York as we move slowly and safely into that first phase of reopening in that part of the state. County executives, thank you very much for joining us today. We greatly appreciate all that you do. Thank you.
Thank you, Steve.
Thank you. Stay safe and healthy.
Stay safe.